Hi everyone, I'm here with Dr. Jake Covert. How you doing, Doc?
I'm good. Thanks for having me.
All right, so you are a chiropractor and you just happen to be in our facility at Parkway Athletic Club in our South Reno location. Um, Thanks for being with us.
Of course.
All right, so lower back pain is so common. And I see people, and we're going to kind of get into sciatica also. So I see people, especially older people, I mean, not even that old, in their 50s, 60s, 70s, 80s. And I'm always watching people. I'm kind of like a people watcher. And way, way too many of them are limping in the grocery store, limping into the grocery store, limping inside the grocery store. And I can tell that 9 times out of 10, it's a lower back issue that is causing that limp. I'm not a doctor, I'm not a specialist or a physical therapist, but I can just tell because I've injured my back before. And so I think, from my side, the health club guy, we want to keep our backs strong. And there's a number of different exercises that will use and strengthen the lower back and the core. You keep that strong. First of all, you're going to prevent injuries. But what happens if it does happen?
If it does happen, especially right afterwards, it's something that you need to there's a lot of different stages. So if you do have kind of like a tweak in your lower back or something's bothering you right then and there, the biggest thing is to take it easy and get light motion into whatever area. Essentially, a lot of people, it's essentially right above their hips. I like to kind of recommend any sort of like kind of pelvic tilting. Kind of gets a little bit of motion in the lower back, some of the joints, some of the muscles moving a little bit, but very light and essentially resting for the right after it happens. And then, but most people, like you said, when you go in the grocery store and you see them limping, it's mostly chronic issues that you're seeing. And there's a lot of causes of different types of lower back pain. And I know you mentioned sciatica. But I mean, even if you do have some sort of pain going down the leg, there's a lot of ways to approach it. And the biggest thing is what you mentioned essentially is kind of that core strengthening, core stability, lower back strengthening. Anything that you can do to stabilize your core and get stronger is always going to help. In terms of what's actually causing it, that's where the variations will come in essentially, because the sciatic nerve, for example, it's several different nerve roots that make up the sciatic nerve, and people essentially lumped it together into one common condition that they point the finger at. But the sciatic nerve is essentially your L4, L5, and then S1 through S3 nerve roots, and those kind of come together as a bundle, and then they come down under kind of around the piriformis region and then down the leg. And depending on where you feel it or how it presents, there's a lot of different treatments for it. And a lot of people just kind of general movements, especially if there are some like acute pain. I've noticed a lot of people like to kind of favor like kind of extension exercises, kind of like some prone press ups on the ground. So if it's any sort of acute lower back pain, that can be helpful depending on your case, is just getting on the ground, getting a light little mobilization essentially in the lower back.
All right, so I want to get into what to do about it because a lot of people are watching this video because they want to know what to do, how to fix it. But first, let's go to the sciatic issue. You named a bunch of places. So that pain we call it deferred pain, right? Where you're feeling it in somewhere, but it's kind of phantom pain. That's not where it's coming from, right?
Exactly.
Okay, so all those different areas you named, tell us in layman's terms where those areas are in your back or wherever you're talking about that can cause that pain in kind of the side of your glute or down the leg. Where are those areas? First, tell us that.
Sure. Yeah, a lot of that pain essentially it can be coming from different places. Like I said, it's kind of I'll kind of work from the top to the bottom, but the kind of the top of the region is where kind of the L3, L4 nerve roots. So kind of right on your spine, the discs in your spine, they can kind of bulge, kind of protrude out, and then if they start
Where on your spine? How high or low?
I'd say kind of like right above your hips, below your rib cage. Anything below your rib cage is essentially kind of where the lumbar spine is, and all those discs right there, if they come out and they come in contact with any of those nerve roots, they can end up sending kind of referred pain, like you said, the radicular pain is what they call it, down the leg. And now, if you were to have that pain, if you can poke on that pain down your leg that you're feeling, if you're feeling tingly, numb, anything like that, and if you poke on it and it's not doing anything, a lot of the times it is kind of like that referred pain, like you were talking about. And so, coming right from the spine, essentially, that's kind of the first location for sciatica, where the pain will come from. And then, if you kind of work your way down, what I mentioned before is the piriformis. There's anatomical variations for people. Some people have the piriformis; their sciatic nerve will actually go through the piriformis. Most people,
Where's
it kind of,
that?
what's
Be-
that?
Where's that? Where's
It's kind of like right in your, yeah, sure. It's right kind of in your glute region, kind of like side of the hip, essentially. A lot of people, there's a lot of tightness that they'll get into that muscle. And with that muscle, if it does get too tight, it can cause something called piriformis syndrome, where it'll kind of push into that nerve, kind of cause that shooting pain down. That's also a good point to start too, is if the pain's just going from your glute down, there's a chance it is just coming from the piriformis and not your lower back. And so
But
that
so let me ask something. So sometimes if you just massage that area, it will go away, right?
Exactly. Yeah, exactly. Because loosening up that muscle will kind of decrease some of the pressure that it's maybe putting on that nerve, and then ultimately stopping that referred pain going down your leg.
Okay, so that would be a simple one. If it's tight, massaging that area, boom, it's gone.
Exactly. Yes, exactly.
Okay, so can you give us some more exercises or treatments that you would do for all of this? And then maybe talk a little bit about lower back pain in general. What can we do to make it better?
Sure. Yeah, I think in terms of, so you brought up the kind of the stretching and the pressure on the piriformis, the side of your hip right there on that muscle helping. For the lower back specifically, I'd mentioned kind of some of those prone press ups. Most people kind of favor that kind of like movement backwards. And so if that is coming from your lower back, if you kind of get on all fours, kind of have your hands right in front of you, kind of like a little sphinx position, essentially pushing straight up to the sky, little
With your
hole there
back?
for your lower back. Yep, exactly. Yeah, kind of pressing right there, that can decrease some of the pressure in there and kind of create the kind of the keyed phrase is like negative pressure on the disc, essentially, where it can kind of bring some of that disc back into your back, stop pushing on the nerve as much, and then ultimately stop causing some of the pain. So that's a good position that a lot of people like to kind of defer on, to kind of push on there, is to just do that extension right there. In terms of lower back pain, just in general, it's really the biggest thing is movement is healing. And so any sort of movement I think is great. And even just walking, simply walking. If you have a lot of lower back pain, just getting up, going for a 20-30 minute walk and getting moving, it's great mentally. Just the research on that is profound as well, just mentally what that can do. But makes you getting a lot of blood flow into the lower back, getting those muscles moving can decrease a lot of pain as well.
But sometimes the pain is so bad you can't move.
The pain, yes, exactly. It is really bad, and that's where I like to recommend, like I said, some of those small movements, like the pelvic tilting, where you kind of put your hands on your hip, kind of feel your pelvis move back and forward like that. Getting a little bit of blood flow into that region can be very helpful. And then when it comes back as well to the core stability, like we had talked about before, doing anything like simple dead bug, kind of having your arms alternating back and forth, getting a little bit of that core work can kind of strengthen that and then take some of the load off of your lower back that your muscles maybe aren't able to do without your core being a little bit stronger.
Okay, so you're talking. I'm trying to ask questions because a lot of people, you're talking over their head. So the dead bug is like this,
Mhm.
opposite leg, opposite arm.
Exactly. Yes. Yeah. Opposite leg, opposite arm. Another great one is kind of like a glute bridge, where if you're kind of laying on your back and then you have your feet underneath you, you squeeze your glutes, shoot your hips up to the sky, getting a nice little firm, like kind of like hold at the top, essentially. Anything to strengthen the glutes is really good with that one. And so, yeah, the dead bug, the glutes, glute bridges, those are two really good starter exercises, I would say.
And then also, of course, there's massage can help.
Massage, yes. Massage can be great. It'll help kind of the pain go away, get the blood flowing, any sort of angry muscles. Chiropractic adjustments are very helpful for acute low back pain. It's actually one of the only things that are indicated for an acute issue. And so, if you get an adjustment, it can essentially immediately relax the muscles in the area, decrease the pain immediately, so that you can maybe go do a little bit more to kind of help decrease that pain further in the future.
Okay, so um, what muscles are important to maintain to prevent back pain or back injury?
Sure. Yeah, I think there's a lot obviously, but the core is the biggest one, I would say. If you can have a strong core, that's going to help out immensely with everything. So core would definitely be number one. Number two, I would say definitely your glutes. Your glutes are going to be a very vital aspect of that as well. Specifically, kind of like the outside part of your hips, kind of like those external and internal rotators of your hips. So anything with the glute med, kind of like right on the side of your hip, of doing any sort of clamshell, or maybe you're like lying down, kind of like squeezing your legs outward, or even just my favorite one, I get people on the wall, kind of flush against it, and they essentially just drag their leg up and down the wall while they're laying on their side. And that one targets the glute med very well. And if you can get that a little bit stronger, that's going to help kind of global glute strength as well going forward.
Yeah, and you can do straight leg deadlifts, and there's a donkey kicks. There's a lot of machines in gyms where you can work the glutes, right?
Yeah, and Parkway has a great one actually as well, because there's a standing glute machine where if you have too much pain to essentially lean forward or get on the ground, it's nice because you can walk right up to it, support your arms right on it, standing straight upright, and then kind of do some glute kickbacks essentially. So that exercise I've actually used for people in acute low back pain where they can't do much, but that's going to help them get a little bit of movement in a position that they can move in.
Okay, so Jake, how do people get a hold of you? You're in Reno, at the Parkway South. How do people get a hold of you? How do they find you on social media?
Yeah, they can go to my website at atlaschiropractic.us, and then my Instagram is also atlaschiropractic.us, and I'm on Parkway's Instagram as well.
All right, Doc, thanks for being with us.
Thank you, Steve. Great to be here.